Hello, everyone. My name is Maya, and I use she, her pronouns. And I'd like to welcome you to our online webinar called Safer Online Dating, Spotting Red Flags, Setting Boundaries, and Safety Planning. Today's webinar is brought to you by the Sexual Health Team. We are a team of 5 peer health educators whose focus is to provide relevant, up-to-date information that's easily digestible to fellow Queen's students. We work under health promotion at Queen's, and we strive to provide you with factual and useful information that you can apply to your everyday life. The goal of this webinar is to utilize a harm reduction framework, meaning we recognize students may choose to partake in online dating and assume that many students use online dating apps. So we want to do our best to provide you with the tools to successfully maneuver any uncomfortable situations that may occur while dating online. We also recognize our positionality as white cis women and how this may impact our webinar in terms of presenting a singular narrative of sexual health and online dating. To ensure inclusivity, we will apply an intersectional lens to this presentation by relying on a wide variety of literature so that we can incorporate diverse lived experiences. We also recognize that this webinar will provide you with a lot of information. So we encourage you to take light breaks, like stretching or reflecting on the material or whatever feels right for you.
Hi everyone, my name is Landon and I use she, her pronouns, and I'll be taking us through the introduction to our presentation. I'm sure everyone has experienced or heard about a negative experience using a dating app. These experiences can vary widely, whether it be receiving rude or unsolicited sexual messages, meeting someone in person who's visibly different from their dating profile, to getting along great with someone only to be later ghosted, meaning they stop responding to your messages with zero explanation. This has led to many people coining unique red flags that are specific to dating apps. Some examples are shown on the slide here, but we quickly realize that the term red flag is super broad in this context. Red flags can be related to someone's online dating profile, for instance, having no photo of themselves or a limited or non-existent bio. These red flags also extend to one's interactions with another person over the app. Some people use the term red flag to identify people who are only interested in hooking up with no interest of a relationship, and others use it to identify those who are not interested in dating. So for instance, people who brag about their sexual prowess or those who are blatantly racist and or sexist. Others even use the term to identify people who are just looking to waste your time. For example, those who keep changing the date that they want to meet up in person, or who take days at a time to respond to messages. Because the term is so broad, we want to clarify what we mean when we refer to red flags from here on out in our presentation. Our definition of red flags are something your potential or current partner says and or does that indicate a lack of respect towards the relationship. This lack of respect is particularly indicative of an unhealthy intimate partner relationship and is linked to various forms of dating violence. So before we delve too far into our presentation, we're quickly going to review why identifying relationship red flags relates to sexual health and why it's so important. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. In a similar fashion, they define sexual health as a state of physical, emotional, mental, and social well-being in relation to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. Sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences, free of coercion, discrimination, and violence. For sexual health to be attained and maintained, the sexual rights of all persons must be respected, protected, and fulfilled. As you may be realizing, having safe and respectful romantic and sexual relationships are a key part of being sexually healthy. As such, we want our presentation to provide you with useful tips and tools that you can use in your own life to help you and others around you stay sexually healthy. At the end of the day, it is important to recognize that we are human, and we can't always anticipate or prevent bad things from happening. Knowledge of red flags can help us to identify unhealthy relationships that we or our friends are in faster and with more confidence. We realize that sometimes red flags can appear later in a relationship when mutual trust or dependence has been well established, and so it can be much harder to avoid or escape dating violence. Please note that the following slides will include reference to sexual violence, dating violence, intimate partner violence, and sexual abuse in the form of text and speech. We are providing this message to allow you to prepare emotionally for the content or to decide to skip ahead to learning objective 1. So what is dating violence? Dating violence includes physical, emotional, psychological, and/or sexual violence perpetrated by a current intimate partner or an ex-partner. We will use the term dating violence to more broadly encompass both intimate partner violence and sexual violence. These terms are defined in the following way. Intimate partner violence, also abbreviated to IPV, describes physical violence, sexual violence, stalking, coercion, pressure, financial violence, or psychological harm by a current or former partner. This type of violence can occur among heterosexual or same-sex couples and does not require sexual intimacy. Stalking by an ex-partner is often overlooked in the IPV discourse, but is very important to highlight. Sexual violence, on the other hand, describes any violence, physical or psychological, carried out through sexual means or by targeting sexuality. Sexual violence takes different forms and can include sexual abuse, sexual assault, rape, sexual harassment, stalking, indecent exposure, etc. It's vital that we make a quick distinction here. IPV encompasses a variety of forms of violence between intimate partners, those that are physical, emotional, psychological, and/or sexual. On the other hand, sexual violence can be perpetrated by current or ex-intimate partners, but also by people outside of intimate partners, for instance, strangers, family members, people in positions of authority, etc. It's also important to recognize that 1 in 3 Canadian women and 1 in 8 Canadian men experience sexual violence. This isn't to say that sexual violence occurs less in men. It's very likely that it's underreported by men due to perceived gender roles, heteronormativity, and societal framing of dating violence as a woman's issue. Since sexual violence encompasses many forms of violence, some forms are more common among men and others more common among women. Additionally, lesbian, gay, and bisexual people experience dating violence at similar or higher rates than straight people. Studies also suggest that around half of transgender people and bisexual women will experience dating violence at some point in their lifetimes. Now we're going to look at the numbers for people with disabilities. Disability in general is defined as activity limitations an adult may have due to physical, mental, or emotional problems and health problems that require the use of special equipment, such as a cane, wheelchair, etc. People with intellectual disabilities are sexually assaulted at a rate 7 times higher than those without disabilities. Again, we can likely assume that these numbers are underreported as well. People with intellectual disabilities are more likely to experience assault due to power differentials between able-bodied persons and disabled-bodied persons. Persons with intellectual disabilities are also less likely to be perceived as credible witnesses in court should they report these crimes. Furthermore, women with a disability are at a greater risk of experiencing rape than women without a disability. An estimated 39% of female victims had a disability at the time of the rape. Men with a disability are at a greater risk for experiencing sexual violence other than rape, for instance, being made to penetrate, sexual coercion, unwanted sexual contact, and non-contact unwanted sexual experiences than men without a disability. Nearly 24% of male victims who experienced sexual violence had a disability at the time of the victimization. For both women and men, having a disability was associated with an increased risk of sexual coercion, which is pressured sex without physical force, and non-contact unwanted sexual experiences, for instance, being harassed in a public place or being made to participate in or view sexually explicit material. Women with a disability are also more likely to report experiencing rape, sexual violence, physical violence, stalking, psychological aggression, and control of reproductive or sexual health by an intimate partner. Men with a disability are more likely to report experiencing stalking and psychological aggression by an intimate partner. It's also important to note that transgender women of color and Indigenous women face the greatest risk of sexualized violence. Transgender or trans women are at a higher risk of sexual violence than cisgender women, with trans women of color reported to be at highest risk. Poor health outcomes experienced by many trans women, for instance, unemployment, poverty, homelessness, and/or survival sex work, are closely associated with exposure to sexual violence and the social inequities and transphobia to which they are subjected. Trans women of color may experience additional prejudice and discrimination due to the intersection of gender, sexuality, race, and social class. Understanding these intersectionalities is integral in understanding the sexual violence experiences of trans women of color. While all women and girls in Canadian society face an unacceptable risk of violence, particularly at the hands of intimate partners, research shows that Indigenous women and girls experience dramatically higher rates of violent victimization. In 2014, the rate of sexual assault self-reported by Indigenous women was more than triple that of non-Indigenous women. In fact, 10% of Indigenous women self-reported having been assaulted by a current or former spouse within the last 5 years, compared with 3% of their non-Indigenous counterparts. 53% of Indigenous female victims were more likely to fear for their lives in comparison to 29% of non-Indigenous female victims. And 25% of Indigenous females were also more likely than the 13% of non-Indigenous females to self-report emotional or financial abuse by a current or former spouse. In over 9 out of 10 cases, 96% to be exact, an Indigenous female victim of physical violence also self-reported an emotional or financial victimization. As such, it is more important than ever that everyone can identify red flags that are indicative of dating violence related to dating app use and meeting people virtually.
All right, so my name is Avery and I use she, her pronouns. Here, Maya and I are going to talk about all the different dating apps that are out there. So let's start with Tinder. Tinder has been called the best for casual dating. Tinder encourages you to make shallow, snap judgments about potential partners. You create a simple profile with a handful of photos and a few sentences about yourself. It is free to use, the basic app, but upgrading to a paid membership gives you premium features like unlimited likes or rewinds that would give would-to-be partners a second chance.
And then there's Match, which is said to be best for long-term relationships, but it costs $45 at Match.com to create a profile.
There's also Bumble, which is a dating app that empowers women and is used by men who want to let women make the first move.
Then there's Hinge, which is best for creating robust dating profiles, but you get very limited likes for free users. And Hinge has recently relaunched their app with an experience that is intended to be less about games and more about relationships and interesting conversations. Hinge explicitly stated goal is to get you to the point where you've deleted the app altogether.
There's OkCupid, which uses data-driven matches and is a great alternative to the swipe if they're hot hookup apps. Most of the app can be used for free, and there's inclusive identification options for gender and sexual identities.
Then there's eHarmony, which is a solid but slightly pricey dating app for anyone looking for long-term love. eHarmony lets data drive its matches rather than just photos.
There's Facebook Dating, which connects with Instagram and other Facebook services. It is completely free, but does require a Facebook account.
Then there's Plenty of Fish, which is said to be the best for messaging without limits. Plenty of Fish is the dating app for singles who don't want to dip too far into their wallets to make a connection. Lots of prompts to send quality messages and options for live streaming as well.
Grindr is the world's largest free social networking app for gay, bi, trans, and queer people.
And then there's Her, which is a dating and social networking app designed with lesbian, bisexual, and queer users in mind. You sign up with Facebook or Instagram, and then view a stream of activity from other verified Her users, both in your area and globally. You can like photos of other users, and if the interest is mutual, the app will link you up to chat.
There are tons of other dating apps out there, but these are just some of the most popular.
If you ever need help reporting dating violence while using one of these apps, check out the link on the screen for instructions. Online dating apps are proving to be both a blessing and a curse. While they now allow us to meet and talk to people we may have never otherwise encountered, they also present many new challenges associated with talking over text. We no longer can rely on body language, gut feelings, or one's tone, leaving many messages up to the reader's interpretation or misinterpretation. Many of these challenges are brand new to our generation, given that more and more people are moving to online dating apps, especially given the COVID-19 pandemic. As such, it is important that we can identify red flags on dating apps so that we can prevent getting into relationships that may lead to dating violence. This leads us into our 4 learning goals for our webinar today. In today's webinar, we have 4 key learning goals that will clearly indicate as we move through the presentation. Please remember to take a break between the learning goals if you need to.
Hi, my name is Siobhan and I use she, her pronouns. Let's begin with learning goal 1. Learn to identify the red flags that are indicative of dating violence related to dating app use and meeting people virtually. Online dating can be really intimidating and overwhelming, and sometimes it can be difficult to navigate what is acceptable and what is not. We will be discussing some of the red flags that are indicative of dating violence and how to properly identify these red flags. A large part of identifying red flags is trusting your instinct. If you feel like something is wrong or off about any situation in online dating, you are probably right. and it is best to discontinue contact. Your intuition is your best superpower. Remember, dating violence does not always occur in person and can easily happen online. First, we will go over some common online red flags, and then we will talk about what to do after you have identified them. Here are some common red flags. Cyberstalking. For example, identity theft, threats, creeping social media, gathering information that may be used to threaten, embarrass, or harass. We have coercive behavior, which can be assault, threats, humiliation, intimidation, or other abuse that is used to harm, punish, or frighten their victim to try and get them to do what the perpetrator wants. Image-based sexual exploitation, also known as revenge porn. Typing things that make you uncomfortable, even when you ask them to stop, or someone is repeatedly spamming you, which means messaging you repeatedly, using inappropriate language such as swearing, racism, homophobia, transphobia, and ableism, asking you to share personal information with them, such as where you live, or pressuring to meet offline. So what should you do if you encounter any of these red flags? Do not give out any personal information. Avoid using identifying images on your profile, such as pictures in front of your house or in your neighborhood. Remember, the block, mute, and do not disturb button is your best friend. Reach out. If you feel as if you are in a position where you are experiencing dating violence online, call the police or reach out to someone you trust for help. At the end of the day, it is important to trust your instincts. If someone is making you uncomfortable or you simply just get a bad feeling, do not hesitate to block or remove them. Your safety is the most important priority, and if you feel it is compromised, there are many resources that can help. Here is a data bank of Canadian resources you can check out for more information. Now, let's take a minute to read over this text exchange. Can you spot the red flag? Hint. Is it coercion, isolation, stalking, or jealousy? Please pause this recording to give yourself a minute to think about it. Hopefully you identified that the red flag in this situation is isolation. This example is from the Red Flag campaign, which aims to bring awareness about dating violence and red flags to university and college campuses. This interaction is providing an example of an isolation red flag as this person is trying to limit their partner's contact with other people.
All right, so now we're going to move on to learning goal number 2. Learn how to set boundaries for yourself and partners when meeting people online, including how to establish and enforce your boundaries and how to catch when your boundaries are being breached and acting accordingly. So in the context of relationships, boundaries define how far you can comfortably go in a relationship physically, mentally, and emotionally. There are several aspects of boundaries, but the most important thing to remember is that your boundaries are about you. You set them, you enforce them, and only you have the power to change them. Let's consider a situation in which you've just met someone you're interested in on a dating app, and you're trying to decide how you would like things to go. With COVID, you don't feel comfortable meeting up, and you want to keep things online for the next little while. When you're setting boundaries, such as keeping things strictly online, it can be helpful to define your reasons for setting your boundaries clearly for yourself. Maybe your reason is that you live with someone who is a higher risk for COVID and you want to keep them safe, or maybe it just makes you feel very nervous to put yourself at an increased risk. Defining a reason for your boundaries isn't so that you can explain them to others, it's to help you. It's also helpful to create boundaries that are realistic and appropriate for your life. For example, you may not be able to decide that you won't stay up past 10:30 p.m. if you have a shift that goes till 11 p.m. twice a week. But even beyond that, it's helpful to have boundaries that are based on your feelings, beliefs, values, and needs. When it comes time to enforce your boundaries, it's helpful to decide how firm or flexible you're going to be. In the context of this person you met on the dating app, is it a hard and fast rule that you're not going to see this person for the remainder of the pandemic? Or is it a more general guideline that you're willing to loosen if you two get closer? Some signs to watch out for that your boundaries are not healthy is if they are set by others, if they are somehow hurtful to you or someone else, or if they are controlling or manipulating. Unfortunately, sometimes due to certain identities, such as being a woman, it can be difficult to have your boundaries respected. Going back to the work example, it is common in certain bars and restaurants for female staff to be expected to accept being touched inappropriately by male patrons. Instead of advocating for these women when their boundaries are breached, bosses may take advantage of their power over them and may even threaten their jobs. The website loveisrespect.org has tons of resources if you want to learn more about boundaries or healthy relationships more generally. So, boundaries in relationships can be emotional, physical, or even digital. So, physical boundaries can look like the following. So, you could say, I'm comfortable with some touching, but I'm not ready to have sex. Or, I would like to be asked before I am touched. Or, I am okay with holding hands and kissing in private, but not in public. Emotional or mental boundaries could maybe look like you saying, I would like to spend at least one full day apart per week. I would like for you to always be honest with me, or I would like for you to be supportive of my personal decisions. And digital boundaries could look like you saying, I'm happy to follow you on social media and give you my phone number, but I would not like to share passwords. I'm happy for our friends and family to know about our relationship, but I'm not ready to post about it publicly. Or I like texting with you, but I will be unavailable online after 10 p.m. The Instagram account @SitWithSharon has lots of great posts surrounding how boundaries in relationships can look if you're interested in learning more. Okay, so one thing that it's really important to have boundaries with is sexting. Sexting has been common for a long time, but may have increased in 2020 with people being unable to engage in sexual activities in person as much, which is why we're talking about it now. Sexting involves sending or receiving sexually explicit texts, photos, or video messages through cell phones or other electronic devices. Sexting has 3 forms. The first one is sending and receiving of sex between individuals who are in an established romantic relationship, the exchange of sex between individuals who hope to be but are not yet in a romantic relationship, or 3, the sharing of received sex to a third party. There are lots of reasons that people sext, such as a desire to be flirtatious, sending a sexy present to a partner, or just replying to a received sext. Sexting comes along with several benefits, such as being a way to spice things up, facilitating communication about sex in a relationship, and allowing one to feel connected to a long-distance or socially distanced partner. Sexting might be more or less common than you would expect. A 2014 study by Renfrew and Rollo found that 63% of university students had sent sexts, 53% had received sexts, 46% had both sent and received sexts, and 32% had done neither. It is completely normal to sext or not. The main risks associated with sexting is that the message will be shared with unintended recipients or that it will be taken too far. Setting personal boundaries surrounding what you are and aren't comfortable with surrounding sexting is important to make sure it's a fun experience for you and your partner. Renfrew and Rollo described a few ways to minimize the risks associated with sexting, such as keeping things light, which could mean avoiding offensive or abrasive language, since sexting stops being fun when it breaches someone's boundaries. Limiting explicitness, so know what you are and aren't comfortable with sending and receiving. And maintaining plausible deniability, which means eliminating identifiable features such as faces, birthmarks, and tattoos. And this is to make sure that if things get leaked, it can't necessarily be traced back to you. Please pause this recording and take a minute to write down 2 or 3 boundaries that you would want to set in each situation. So the first situation is, you just met somebody that you are very interested in on a dating app during COVID-19, which is a situation I talked about before. And the second situation is, you are in a long-term relationship with your partner. So for both of these situations, let's go over some of the boundaries that our team set. So for situation number 1, we said a couple of boundaries in this situation could look like, if I decide to sex with this person, I will avoid any personal or identifying information in the picture, for example, my tattoos or face, and I will only message this person after 5 p.m. until I go to bed. This way I can concentrate on my work during the day. And for situation number 2, we said that boundaries could maybe look like saying, I will set aside 1 week a night to go out with my friends without my partner, and I will clearly communicate to my partner that I don't want them to go through any of my belongings unless they ask me first. As you can see, setting boundaries can help reduce harms associated with online dating and can also help with effective communication in long-term relationships. Boundary setting will differ for every situation that you are in, so make sure that you consider what boundaries are right for you in different scenarios you experience.
So now we're going to move on to learning goal number 3, where we will learn how to use the MyPlan app to safety plan in case you or a friend is experiencing or at risk of dating violence. The MyPlan app was developed to help individuals create safety plans for themselves or a friend who may be experiencing or at risk of dating violence. It is also designed to help identify if a situation is unsafe, allowing users to gain insight into their situation. The MyPlan app was developed in response to 3 key research findings. The first is that dating violence occurs at disturbingly high rates on university and college campuses. The second is that safety decisions may change over time and are influenced by several factors. These factors can act as barriers or facilitators to creating a safety plan. Factors may include time, resources, and a combination of individual and social factors. An example of individual would be feelings for a partner, and an example of social factors would be like loss of financial support. Students in abusive relationships may have unique factors, like academics, housing situation, or social stigma that influence decisions regarding their dating life. The third factor was that women disproportionately experience dating violence and are more likely to seek out informal support, commonly from friends, than to seek formal support from campus or community resources. It was also found that friends often lack skills such as the confidence or knowledge about campus or community resources to effectively help their friend. That being said, the MyPlan app can be used by all genders. The aim of the MyPlan app is to reach more university and college students who are experiencing or at risk of dating violence by providing a resource within the support system that students are more likely to use, like their friends, and to bridge these support systems with community and campus support systems. The goal is to facilitate effective safety planning by allowing users to tailor their plan to their personal and social factors. Overall, the app's goal is to prevent and reduce dating violence. So to use the MyPlan app, you first need to download the app. It's free and it's available on the App Store, Google Play, or it can be accessed on a web browser. Then you need to set your PIN code. This will keep your information private. Once you download the app and you set your PIN, you will then complete the assess tasks so that the recommended resources and strategies are tailored to your situation or the person's situation that you are helping with. The more assess tasks that you complete, the more likely the resources and strategies will be suitable for you or your friend's situation. You then can use the decision and aid feature to set priorities. Then you will create a plan using the resources and strategies that are recommended. So while using the app, there are some tips that you should consider. If possible, use a device that the abusive partner cannot access. Choose a PIN code that is random. Avoid using numbers that have personal meaning to you or your friend. Clear your browsing history or use the private incognito mode while on a browser. It is not possible to delete the app from your purchase history on Apple devices, so using the browser format instead of downloading the app will avoid this. You should also delete the app when you are done with it. Lastly, the app will provide users with a 4-digit PIN code that will unlock safety mode. Using this PIN code will display content about how to stay organized, hiding any content about you or your friend's safety plan. It is recommended that this code is used if someone forces you to unlock the app. Okay, so now we're going to do our activity number 3, which is going to be exploring the MyPlan app. We will take 5 minutes and go through the web browser format of the app and complete an assess activity. Okay, so first you're going to click Get the App, click Browser App, and then follow the prompts. And now set up a password. And then in the bottom, it's going to say assess. And we're going to click my situation. Just take a minute here to fill this out. So hopefully you now feel more comfortable using this website and completing an assess activity. We recommend that you take a minute to clear your browsing history now. Don't forget that it is also available as a mobile app, and it is a private, secure, personalized, and backed by research app.
Hi everyone, my name is Kristen. I use she, her pronouns, and in this section, I'm going to be going over learning goal number 4. In the final section of this webinar, we're going to learn about resources to help you and your friends actively manage your sexual health. One of the most important parts about living a healthy lifestyle is learning how to actively manage your sexual health, both your physical sexual health and your mental sexual health. We'll be going over topics such as different forms of contraception and how to get them in Kingston, how to get tested for sexually transmitted diseases or STDs, and answering some common questions, as well as good practices from the sexual health team here at Queen's University. There are many different forms of contraception available for everyone and all different relationships. Some common forms include the male or external condoms, the female or internal condoms, oral contraception, also known as the pill, vaginal rings, contraceptive patches, or intrauterine devices, commonly called IUDs. Other forms include birth control injections and implants, the diaphragm, or even surgical methods. It's important to recognize that there are advantages and disadvantages of each of these methods, but you should know that there is always contraception available for your relationship if you are looking for it. In this presentation, we'll be going over the most common methods, the external condoms, internal condoms, IUD, birth control pills, and the patch. First, let's talk about the two most common types of condoms. First, there's the external condom, which is approximately 85% effective if used correctly and costs around $2 per use, but it must be worn every time you have sex. Some advantages of this form of contraception is that it can be stopped immediately if you and your partner are looking to get pregnant. They're easy to use and they prevent against both STIs and pregnancies. However, some disadvantages of this form of contraception is that they must be used every time you have sex, and it can break if used incorrectly. Condoms also must be stored properly to maintain their effectiveness. The other common form of condom is the internal condom, which is approximately 95% effective when used correctly and has a similar cost to the external condom, or around $2 per use. Again, these must be worn every time you have sex. The advantages of the internal condom is that it's very inclusive and protects both partners from STIs and pregnancies with very few side effects. However, some disadvantages are that it must be worn every time you have sex and may break if it's used incorrectly. Additionally, internal condoms may not be as widely available as male condoms, so they might be harder to find. A dental dam is a thin, flexible piece of latex that protects against direct mouth-to-genital or mouth-to-anus contact during oral sex. This reduces your risk for sexually transmitted infections while still allowing for clitoral or anal stimulation. This is a great option for people who are not engaging in penetrative sex. Hormonal pill, also commonly called the pill or birth control pill, is around 91% effective and costs $50 a month, but this is typically covered by insurance. The pill is taken once daily and generally must be taken at the same time every day. The advantages of being on the pill is that it's very effective if taken correctly, and it may help with acne or PMS symptoms. Additionally, it can be stopped immediately if you're looking to get pregnant or are experiencing adverse side effects. Some negatives of being on the pill is that you have to remember to take it every day, and it may have increased mood swings or periods. Next, we have the IUD. IUDs are extremely effective at around 99% if they're inserted correctly. And a copper IUD costs around $36, or hormonal IUD costs around $200. These are inserted by a clinician and are typically used for 3 to 10 years. It's important to note that the cost of the device is usually covered by insurance if you're 24 years or younger. And then the insertion appointment is always covered by OHIP. So overall, they're a pretty cost-effective method. Some advantages are that they're extremely low maintenance, and you can't forget to use it, unlike the birth control pill, which you have to take every day. Additionally, an IUD cannot be used incorrectly, as is the case with condoms. This type of contraception is known as a set it and forget it method. Hormonal and non-hormonal options are available. As previously mentioned, you can have the copper or the hormonal option, and it is reversible, so an IUD can be removed by a clinician at any point if you'd like to remove it. Some disadvantages is that this form does not protect against STIs, and it must be inserted by a clinician. Additionally, IUDs may lead to heavier periods or cramping, depending on which form you get. We'll be going over where to get IUDs inserted shortly, but the general process of obtaining one is very accessible. First, contact your primary care physician or go to a walk-in clinic to discuss contraceptive options and decide which one is best for you. If you do decide that an IUD is the best method for you, the physician will give you a referral to a gynecologist's office. In one appointment with the gynecologist, they will have a consultation to answer any questions you may have. They'll then explain the procedure, what to expect after it's been inserted. If you choose to have it inserted, they can do it on the spot that day. Another method is the patch or the birth control patch. This is approximately 91% effective and costs around $80 for the device, but it's usually covered by insurance. Like the IUD, it requires a prescription from a healthcare provider. Some positives is that it's very similar to the pill and it's very, very effective if taken correctly. Like the pill, it may help with acne, can be stopped immediately, and may help with PMS effects. However, you have to remember to change the patch on time, and some side effects like spotting in between periods, headaches, or weight gain are quite common if you're on the patch. Since this form of contraception requires a prescription from your healthcare provider, it's best to go to a walk-in clinic or speak with your family doctor if you're interested in getting it. Finally, we have the birth control shot or injection. Like the IUD, this is very effective at 99% and is taken once every 12 weeks, but it must be used by a healthcare provider. The advantages of being on the birth control shot are that it's very low maintenance because you only have to use it once every 3 months and it's very discreet. Additionally, it may make your periods lighter and less cramping. However, if you're afraid of injections, this might not be the best option for you, and you may have similar side effects to other hormonal methods, such as the birth control pill or the patch. Additionally, it may take up to 10 months to get pregnant again once you have stopped taking the shot. So if you decide to remove your contraception at any point in time, you will have to wait a while. Again, since this requires a healthcare provider to perform the injection, it's best to go to a walk-in clinic or speak to your primary care physician about it. Now that we've covered the basic forms of contraception available, let's talk about how to get them and where you can go to learn more and make the best decision for yourself. Regardless of which method you choose, it can be important to discuss your choice with your partner or partners so that you may make the best choice for all people involved. Depending on the situation, you may choose to favor STI prevention over pregnancy prevention. So barrier-based methods such as the internal and external condom may be more effective than the hormonal methods. If you're looking to buy condoms or refill a prescription of birth control, patches, or pills, Shoppers Drug Mart is a great place to go. While Shoppers does not offer STI or UTI testing, they are very inclusive and a quick and convenient place to get contraception. The closest Shoppers to main campus is at Princess and Division. Similar to Shoppers, the Drug Smart Pharmacy at the Arc is a great place to go for quick and easy contraceptive options. They offer all the same services as Shoppers, but if you go here, hormonal contraception, such as birth control pills or patches, may be covered under your Queen's health insurance if you did not opt out during your fees, so you pay very, very little out of pocket. However, if you're looking for contraceptive options that require a physician's appointment, here are the best places to go near the Queen's campus. First, there's the CDK walk-in at 175 Princess Street, which can prescribe birth control, pills, and refill a prescription. It's unclear if they have a contraceptive clinic, so I generally would not recommend going here. However, they do offer walk-in UTI and STI testing. Medical Tree Walk-in Clinic can provide birth control pills and do offer IUD insertions and consultations. The Medical Tree Walk-in Clinic does run a contraceptive clinic, but the waitlist for IUD insertion is approximately 9 months long. Pills can be prescribed on the same day as a walk-in appointment. The Medical Tree Walk-in Clinic does offer STI and UTI testing. Finally, we have the Coach Sharp Student Wellness Center in Mitchell Hall. Here you can prescribe or refill prescriptions for birth control pills. They do offer IUD insertions and consultations, but an appointment is needed. They also offer emergency contraception, commonly called Plan B, but it would be faster to go to Shoppers or the Arc Pharmacy as it does not require a prescription. Almost all services offered here are covered under Queen's Healthcare Insurance. Finally, we have some general tips from the Queen's Sexual Health Peer Health Educators. If you're going out or going home with someone, share your location with a friend and let them know who you're with. Keep emergency contraception on hand. Plan B is kept behind the pharmacy counter at Shoppers Drug Mart and Drug Smart and can be used in cases of emergency, for example, after unprotected intercourse or a known or suspected contraceptive failure. Please note that some forms of emergency contraception require a prescription and others are available without a prescription but are kept behind the pharmacy counter. For more information about Plan B, please check out the link present on the slide. You should also discuss boundaries and consent with all partners. Finally, reflect on the topics of this webinar and talk with your friends about it too.
We hope you enjoyed our webinar today. Because there was so much information, we've compiled some key takeaway points. Firstly, dating violence can happen to anyone. There are several in-person and online resources available to help you navigate difficult situations. It's also important to always trust your instincts when it comes to online dating red flags. If something feels wrong, use the mute, block, or unfriend features available on dating apps and social media platforms. Also remember to create reasonable boundaries that reflect you and your needs, and respectfully communicating these boundaries to your partner or partners is crucial to engaging in safer online dating. But also be mindful and considerate of other people's boundaries. The MyPlan app is an accessible, feasible way to safety plan if you or someone you know is experiencing dating violence. The app is a great way to learn about resources within your community. Lastly, taking care of your sexual health is an important part of maintaining your general well-being. Consulting healthcare providers or asking anonymous services like Student Wellness Services Anonymous Ask Me Anything About Sex Forum is a great way to find accurate sexual health information and answer any questions you may have. Before we end, here are a few Queens and Kingston specific resources for your reference. Thank you for watching our webinar brought to you by the Sexual Health Team. We hope you found this webinar useful and now feel more comfortable identifying red flags on dating apps, setting boundaries for yourself, using the MyPlan app, and taking care of your sexual health. Thanks so much for watching and take care.